and I'm here with Tony Glebe and Katy Tarella. Tony Glebe is the head of business development. Tony is a seasoned business development and strategy executive with over 20 years of experience helping healthcare companies create new solutions and build high growth businesses. As head of business development, Tony's responsible for guiding Octave's growth strategy and for building relationships with payers, providers, and enterprise partners to enable that strategy. Over his career, Tony has held a variety of positions with healthcare organizations ranging in size from pre-revenue startup to Fortune 50, in addition to founding and leading a boutique healthcare strategy consultancy. And then we have Katy Tarella, who is the clinical director in LA. Katy is a licensed clinical social worker, experienced clinician, and mental health care leader. As the clinical director of the LA office at Octave, she leads the development and implementation of evidence-based treatment and measurement-based care for clients. Prior to joining Octave, Katy served as the clinical director of the outpatient program at Clearview Treatment Programs in LA, clinical director of the outpatient program at Mind Therapy Clinic in the Bay Area, and as a family therapist and milieu manager at the Gunderson residence at McLean Hospital in Boston, Massachusetts. So thank you all for being here. And I will now turn it over to Tony and Katy to present today.
Thank you, Melissa. Appreciate the introductions, and thanks everyone who was able to dial into today's presentation. I'm just going to spend a little bit of time talking about who we as an organization, Octave, are, so that everyone on the call has a little bit of context for what we do and who we are. And then I'm going to turn it over to Katy, who as one of our lead clinicians in the Southern California market can talk a lot more about the kinds of problems that we help people with and the kind of care that we deliver. So just to help people understand at a very basic level, we are an in-network psychotherapy practice. We operate today across the entire state of California as well as New York. In California, we are in network for all commercial members of Anthem and Health Net MHN, which means that for all of you that are on the phone that are faculty and staff of the UC system, you actually do have in-network access to Octave through either our Health Net or Anthem, depending upon which plan you're on. We offer care across the entire state of California virtually. However, there are some providers that are only exclusively offering care virtually. We are offering care both virtually and in person. Today, we have brick and mortar clinics in San Francisco as well as Los Angeles. They're actually not open at this time. Through the pandemic, we flipped all virtual just out of consideration for the pandemic. We will be opening up our brick and mortar clinics over the course of the next couple of months. It's important to understand that today we do not have a brick and mortar clinic in Santa Barbara. However, if you're in close proximity to Westwood, or if you're headed up to San Francisco, we have clinics there, and we'll be expanding our brick and mortar presence across California in the coming year or two. However, we can see anyone virtually in the Santa Barbara area today. Our practice is really focused on a couple of things. One is delivering high quality care, which is an easy thing to do, but I think I turn it over to Katy and she talks a little bit more about our approach to hiring therapists, our approach to delivering psychotherapy. She can give you a better feel for what that actually means to not only be able to get an appointment with a therapist, but be able to get an appointment with a therapist who is going to deliver quality care and really help people that are struggling feel better. And one of the key elements of that is that we actually operate in a philosophy that includes a few different modalities, but really are about measurement-based care. I can talk a little bit more about that, what that means in a second. But maybe first, for broader context of why we are around and sort of as a therapy practice, why we exist and what we're really focused on. And I think this slide probably speaks to what many of you may have found if any of you or your family members have been out in need of help with mental health and you've tried to seek out care. It is true on a national basis that many providers just simply aren't accepting insurance. And what that means is in the state of California, that's particularly a big challenge. When it means that very few therapists accept insurance, that means that many people aren't able to receive care, or if they find a therapist who's in network, they might be on a 4 or 5 month wait list. We know from talking with Melissa and Patty that that's certainly been an experience of many people in Santa Barbara area. And that's really the main problem that Octave was created to try to and address directly. We've been able to work with Anthem and HealthNet in California to commit to really a few different things that are designed to deliver a fundamentally different experience for all UC faculty and staff, as well as others that have Anthem and HealthNet benefits. And that is really exemplified in this concentric circle diagram. So starting from the low end, we're really bringing more therapists in networks, or agreements with Anthem and HealthNet are such that it allows us to essentially compensate therapists at a higher rate. That means more therapists that previously weren't willing to accept insurance are now choosing to accept insurance and coming to work for Octave. That just gives more capacity and more options for people to see in-network therapists. The second thing is that part of our agreements with Anthem and HealthNet really hold us accountable to getting 90% of our clients in for their first appointment within 10 days. Again, if any of you have been out seeking care for yourselves or your family, I'm sure you're well aware that getting in for a first appointment within 10 days is definitely not sort of the typical scenario for really anybody in the country. But we want to make sure that we deliver a different experience when people need and want care and get to the point where they're actually willing to ask for it, that we're there to help them. So 90% of our patients get in within 10 days. We're also committed to delivering on outcomes. So there are a couple of different ways that we can measure that. The PHQ-9 and GAD-7 are simply sort of clinical standard measurement instruments that really measure depression and anxiety specifically. So 60% of our patients show significant improvement on either depression or anxiety scores within the first few months of care. That's actually quite high compared to what you find in the broad literature. And so again, Katy will talk about this in a little bit, but our approach to measurement-based care and outcomes-driven care means that when our clients come to see us, we do sort of a much better than average job on helping people actually get to a place where they're feeling better and better able to function in life. And then beyond that, we also have commitments with our payer partners to deliver a positive experience. So whether that means getting scheduled for an appointment, whether that means potentially having issues or questions with billing, those kinds of things that aren't necessarily about the care we provide, but they're about just the way that your interaction is with our organization. We have commitments around something called Net Promoter Score, which is a common customer satisfaction tool, to be above a certain threshold. And we've been well above that and well above 2 times the healthcare industry standard. So really, in a nutshell, this is sort of the service that we provide. We've got in-network therapists. They're in network for all UC employees. You can get in for an appointment within a couple of weeks. We deliver really good care and a positive experience. I'm going to turn it over at this point to Katy. Katy, as Melissa mentioned at the beginning, is our clinic director for the Southern California market. So not only is she a clinical professional, which gives her a lot more credibility than me to speak about things like this, but she's also responsible for all of our therapists in the market and all of the therapists that would likely be seeing any of you within the UC system. So Katy, if you want to take it away and talk a little bit about our practice, that would be fantastic.
Yeah, absolutely. Thanks, Tony. And thanks for having us here. I'm really excited actually to talk about Octave because I love working here. So one thing I wanted to really touch on are therapy services. So what do we offer? What kind of modalities we use? And so something that's really important and integral to Octave is using evidence-based treatment. So EBT, it's like therapist lingo, but just to break it down, those are things like cognitive behavioral therapy or CBT, dialectical behavior therapy or DBT, things that are goal-oriented and shorter term, but not, a couple months, like longer, several months to a year, but something that can really help you come in, identify your goals, make changes, steps to like actually achieve that and make meaningful change in your life. And so we use, Tony mentioned in the last slide, we use 2 measures, actually 3, the PHQ-9 and the GAD or GAD-7. So we're just looking at, with these measures, how are your depression symptoms? How are your anxiety symptoms? And we also have a therapeutic alliance scale, which is really, really awesome, so that we can consistently look at how's the relationship between the client and the therapist. Are we getting it right? Are we missing something? Are we culturally considerate? You know, how are you feeling in that? And so I think these are really, really important pieces here. I'm not going to go through it, but you can see specialties, different types of symptoms people might come to therapy for. And then on the right-hand side, the modalities being different types of evidence-based treatment or types of therapy that you might be seeking for different reasons. And so we have a pretty wide array there, which is very, very exciting. So you can go to the next slide, Tony. Something that is new and extremely exciting. I might be kind of like a therapy nerd on this, but it is definitely something that enhances our services. Is what we're calling centers of excellence within Octave. And so this is an addition to our clinical services, and we are looking at areas that we want to specialize in. So we have therapists that are coming from all different experiences, walks of life, different backgrounds, and we are trying to mobilize that and use what we already have and hire out into what are you bringing to the table? All of you are individual. How can we use that? So we really want to have, you know, some specialty services offered. We want to be inclusive. We want to be looking at who is coming to us for services. Do they feel represented? Do they feel like they have a place here with a therapist who can really understand them? And can we offer that? So here we listed a couple of examples of the areas that we're focusing on. So the centers of excellence that we are developing and pretty close to rolling out, like almost kind of imminent. And we're just adding more and more as we understand what our clinicians can provide. DBT is dialectical behavior therapy. That is a center of excellence that I'm leading. So getting clinicians in to offer a pretty specialized service, actually, that is in-network and insurance-based. So you can take that into these other COEs, I'll call them centers of excellence. We have a queer resilience clinic, so really focusing on LGBTQIA plus particular struggles. How can we be culturally and therapeutically sensitive and responsive to that? And we're really trying to develop our women's health center of excellence in different ways, but very, very exciting to me and to Octave to be able to look at perinatal, postpartum, any of the gamut of kind of struggles or difficulties that could come into play when you're dealing with that in your life. And so having a place to go and people who actually specialize in this. So just really wanted to mention that to make sure everyone knows that if you're looking for different types of services, we aren't a one size fits all. We can really and want to offer specialty services in a way that's responsible and clinically excellent. So it's our centers of excellence. Tony, thank you. So this is another piece of the puzzle that Tony touched on in presenting what we do here at Octave is we want to make the process of accessing therapy and accessing what you need and getting help as seamless and as honestly easily as possible. So often the barrier, I don't know if anyone on this call has experienced this, I imagine so, accessing therapy or like quality care is really difficult. And accessing care that is in network and covered by your insurance is extremely difficult. Like it's just like another level of difficulty. And so we want you to be able to come, you know, to our website, to other referral sources that or seeking our help that Victor will talk about a little bit towards the end of this presentation, but can we help you get through this process as quickly and as easily as possible? So that's what we're talking about here on this slide. Onboarding looks pretty easy. What can we help you with? You take the measures on depression and anxiety to understand where you are right now, which we would call a baseline. use that to formulate like a really good treatment plan, something that is going to focus on your goals and help you get relief faster. And then we have two branches here, so I won't go too much into it, but on the left, the instant matching is if you are looking for kind of level of general care and we have a provider available and we have an appointment available that fits into your needs, which is very important to take into consideration too, because we can't all be going to therapy in like the middle of the day, or sometimes beginning of the day or end of the day works or whatnot. So that is one kind of avenue. And then we also offer, which is really important, this other avenue in which if you are experiencing something that needs a specialty service, like I talked about in the last slide, like centers of excellence needing a particular focus or a particular expertise, then we offer a free consultation where our team reaches out to you very quickly, proactively. What do you need? Does some more assessment and figures out how we can get you into care as quickly as possible. All that to funnel to your first appointment. So very, very important for us to get that happening as soon as possible and to remove the barriers for seeking treatment that are rampant in our industry. Go to the next one. So I'm going to transition a little bit and talk about something that I think is helpful as far as what people may be experiencing at this time, and how to understand when do I need to get professional help, because it can be really, really hard to know if you've never had therapy before, you had it in the past and you had a bad experience or wasn't quite what you needed. So just wanted to address that state of mental health today. I mean, I'm sure everyone on this call can relate in some way, but it's a stressful time in the world right now. There's an ongoing global crisis with our pandemic, COVID, like having to deal with that. Then, you know, in the last several months, not to go into detail, but other really difficult world events that are really often I'm seeing in therapy with clients and just within myself and coworkers, and trying to have conversations about how hard it is to manage stress and overwhelm at this time. So I want to talk a little bit about stress versus anxiety versus something that we call a mood or anxiety disorder that would be indicative that you really need to proactively seek out that level of professional help. Okay, so let's talk a little bit about the difference between stress and anxiety, because it can be very hard to tell the difference at times. So stress is caused by a very particular and identifiable external trigger. So I'm sure people can relate to having that work deadline, that presentation that you have to do, that something that is discrete and you can say, I'm done with it. And after, often your stress alleviates. So it could be, I already mentioned that, but it could also be kind of a conflict with a relationship or something that you can kind of work on, but is definitely upping the level of stress. The thing about stress versus anxiety is that they show up the same way in many instances. So stress causes mental and physical symptoms. So you might notice irritability. Big one is difficulty sleeping. That's such an important thing to notice. Is your sleep pattern changing? Are you having a hard time? You're feeling tired all the time, not falling asleep, sleeping too much? Really, really important. Stress creates this level of muscle tension, digestive problems, all these sorts of things that one-off may be easy to say, that's just whatever's going on right now. And it may be that you get back on track as things alleviate in your life. So that's what we're like defining or calling stress, which is one thing. Another side of the coin is anxiety. And so the difference between stress and anxiety is that anxiety is more persistent and more, pick the right word, more impactful on your day-to-day functioning. So with stress, you may be able to show up to work, you may be tired, you can have a little extra coffee and you can get through the day, but anxiety takes it to another level where it feels like you can't show up for like things you love, relationships that are important to you, you're kind of struggling in those ways. So the presence of anxiety will be persistent and also characterized by excessive worries. So let's say you have that work deadline, you get the product in, you do the presentation, whatever it might be, but you still can't stop worrying about something. So it's excessive. Did I do a good enough job? Is my boss going to fire me? Like, kind of goes to a next level that maybe should alleviate, and you want to pay attention to that. So again, I'll just emphasize, as I said earlier, the symptoms of stress and anxiety can look and feel the same. Anxiety is that presence of the symptoms even when that external outward trigger is gone. You can notice, hey, I'm still not bouncing back. What's up with that? Another thing that I want to talk about is types of psychological disorders. So these are things that are diagnosable. And so it's not the only part of therapy is to get the right diagnosis or to be like kind of in a one-track mind about that. But we do need to recognize when things have gone to a level that we aren't equipped to deal with, and nobody should be. That's why we seek therapy and why we seek professional help. So 3 of the disorders that I wanted to just touch on quickly today are mood disorders, anxiety disorders, and adjustment disorders. So I'm building off the idea of what is stress versus anxiety. So mood disorder, you might have heard of these things or even like experienced them or sought help for them in the past, but examples are major depressive disorder or dysthymia. That's a persistent low mood over a very long period of time. I didn't mention on the slide here, but bipolar disorder would also fall in that category. So again, persistent is a really important word. Persistent depressive symptoms, low mood, big one, lack of interest in things that you normally like doing. Sometimes you don't notice it, but if you take a step back and be like, I'm not doing that thing, I'm not socializing, I'm not playing tennis, even though I've loved it in the past, I don't feel like it. Sleep disturbance, and a big one too is, am I experiencing excessive guilt or hopelessness when maybe it doesn't fit the situation, but I can't let it go? So that might be one type of thing that you really want to seek out professional help for, just noticing some of these signs. Another thing to pay attention to is an anxiety disorder. So examples of anxiety disorders are generalized anxiety disorder or panic disorder. Might also think about obsessive compulsive disorder. Things that fall in this category are again characterized by persistent and excessive symptoms. So excessive worry, what we call distorted thoughts. So we all have these thoughts time to time. It's again about persistent and excessive, but catastrophizing, going to the worst case scenario, mind reading, thinking you know what someone is thinking about you, and just being really kind of in your head about that. And then this other thing that I wanted to mention is when we're stressed, we might feel kind of like up, like tense, or kind of have like this unease or restlessness. When it crosses over maybe to more of an anxiety disorder that you need to get professional help for, is like feeling on edge most of the time, feeling like your heart beating really fast, feeling maybe sweating, feeling like you're just kind of ready to go, and that really gets in the way of living our day-to-day life. So it's something to pay attention to as well. And then lastly here, I just wanted to touch on the idea of an adjustment disorder. This is somewhere kind of in the middle of the idea of stress goes on in life. We all will experience stress. We can kind of move through it, bounce back from it. And then on the other side of the coin being a mood or anxiety disorder, adjustment disorder is somewhere in the middle there, but still would really benefit from professional help. So you have a significant stressor in your life. So I put on this slide here, loss of an important relationship, divorce, or like a rupture in a relationship, something that happens. Stressors that accumulate over time, like important like issues at work, trouble with a colleague or a boss, or worries around, should I get a new job? Like, am I happy here? These sorts of things that are kind of a little bit more impactful than your day-to-day stress, that you then develop symptoms of anxiety or depression, like being on edge, being worrying about things that are not necessarily grounded in, if you check the facts, like your reality, or really, really low mood for a period of time and not being interested in things you once were. That can be what's called an adjustment disorder. And so it will alleviate over time once the stressor is lifted. But in the meantime, it's really hard to handle. And you may not have the coping strategies. Like, let's say you have a difficulty at work, for example, and you're really stressed out. Exercising helps. Like checking in with friends, like looking to your support system. An adjustment disorder would be a little bit more than that. Like, I can't get myself to exercise, even though I normally love it. I can't get a good night's sleep, even though I normally kind of know how to do that. So things that just come out of your norm or what you're used to and how you're used to coping with things. So these are just 3 examples I wanted to give, because as far as what I think about as a therapist and what I want my clients to know is that there are times when your level of distress is more than you can cope with, and you need help with that. So those are some ideas just to help you understand, like, should I pay attention to that? Should I maybe reach out for help? That's been a problem for a while. I can't kind of like shake it. So there's some ideas there. And then Tony, if you just want to go to the next slide. All that to be said, when should I seek professional help? This is kind of a felt, like, known thing, and I don't know how to put it like more academically or clinically, but do I feel like myself lately? Do I feel like I'm showing up to the way I want to at work, in relationships with my kids, with my significant other, with, you know, any of these areas that are important to you? Do I feel like myself? And that's a good pause question, is take a step back. With that kind of curiosity, or just taking a beat here, think about what I've mentioned here. So stress may be temporary. If it's leading to you feeling like you can't cope day to day, things are getting worse, and it's impacting things that are important to you in your day-to-day life. And the same thing with depressive symptoms, really low mood. I'm having a hard time doing things that I once very much enjoyed. What's up with that? It's a good sign to reach out and get professional help with therapy. And I can't emphasize this enough. It's literally never too late or too early. I mean, we all could use some like feedback, support. So even if you seek out therapy and they're like, okay, I can move on from that quickly, or I can get coping skills, or you've been dealing with this for a long time and you feel like I should have already gone to therapy or sought help, try to remove the judgment from that and just know that no matter what, if you're going to seek out someone who has specialty in helping you with what you need, it's great either way. So I wanted to emphasize that, and thinking too about how we can offer services quickly and easily and without as many barriers as you might experience in past seeking out of professional help. All right.
I think that's it for sort of the formal presentation. Appreciate it, Katie, and again, appreciate everyone for joining. I believe, will have this information available to people after the call, but on the slide you can see there is a place that you can go to register for or request therapy, provide us with some additional information. If your family member is interested in and in need of therapy, we're certainly here to help. I think we've also got time for any questions that people might have. Maybe Melissa, I'll turn it back over to you.